Hi, I'm Howard Wetzman, Chief Medical Officer of Townsend. We often get questions about medication treatment, so today I'd like to take a few minutes and talk to you about that. In understanding why addiction medicine physicians use medication in treating the illness of addiction, it's important to understand what an illness is. An illness is a dysfunction of some part or system of the body. When a physician uses medication, it is to return that part or system to normal function, or as close to normal as possible. It's also important to understand that a medication is not a drug. A drug is something we take to change the way we feel immediately. A medication is something we take to return a damaged or ill part to good function over time. To use medication well to treat addiction, the physician must first understand and identify the area of dysfunction in the brain. For most people with addiction, the problem is too little dopamine, though for a few, the original problem was too much dopamine. This is the first goal of the addiction medicine physician. Determine if the patient has type 1, high dopamine, or type 2, low dopamine addiction. Treating type 1 addiction is a complex problem. The original increased dopamine in parts of the brain outside of the reward system led to the use of sedatives. Those sedatives caused dopamine spikes in the reward system, damaging the reward mechanism and leading to low dopamine in the reward center. So now we're faced with high dopamine in other areas of the brain and low dopamine in the reward center. The physician's role here is to cover the original symptoms first and then apply the necessary treatment to restore dopamine to the reward center. This latter is the same as the treatment for type 2 addiction. Type 2 addiction is characterized by low dopamine tone in the reward system, but can occur for many reasons. Perhaps the person doesn't make enough dopamine, or doesn't release enough dopamine, or the dopamine receptors can't see the dopamine once it's released, or even that the receiving cell can't send on the signal. There's no one medication that can fix all of this. So the addiction medicine physician and the patient have to understand where the problem lies. A good part of that answer can come from the history the patient gives of what drugs alleviated what symptoms when used. Knowing which drugs do what tells the physician what part of the dopamine system needs attention. So once the patient and physician understand where in the system medication is needed, they may use the appropriate medication for the appropriate job. It's important to remember that medication doesn't act quickly, but over days, and must be taken as directed to be of best use. If the problem is dopamine production, medicines such as Deplin can be used in problems of genetic origin. About a third of patients have a genetic inability to fully convert folate to L-methylfolate, an important part of the production of dopamine. Deplin is L-methylfolate, and this returns dopamine production to normal in many cases. Once dopamine production is normal, the physician and patient may consider the need to increase the release of dopamine if they feel dopamine release is not normal. Medications such as Suboxone and Chantix can be helpful by partially stimulating receptors on the dopamine-producing cells that cause dopamine release. Another medicine called MSAM can increase dopamine release by stopping premature dopamine breakdown inside the dopamine-producing cell. Once dopamine production and release are normal, the doctor may use medications such as Wellbutrin or Aplenzin to increase the level of dopamine at the receptor in order to raise dopamine tone. Another problem that sometimes arises in treatment is the dopamine spike. In most people with low dopamine tone, the brain compensates by increasing the spike of dopamine that happens from a rewarding stimulus, like, for instance, taking a drug. As we raise dopamine tone, this dopamine spike usually falls back to normal as it is no longer needed. In some people, this doesn't happen, and they need medication to help lower the spike. When that's necessary, medications such as baclofen or the anti-epileptic medicines are effective. Finally, even with normalized dopamine tone, There are times when people with addiction experience something called cue-induced craving. Cue-induced craving is mediated by a glutamate signal from the emotional memory part of the brain to the reward center. Medications such as Camprel can be helpful in lowering or eliminating cue-induced craving after dopamine tone is normalized. No discussion of medication in addiction treatment would be complete without mentioning the reason to use it. The only reason to use medication in addiction is to return dysfunctional systems to normal or close to normal functioning so that the patient can engage in recovery. None of the medications will work well with low levels of dopamine receptors, and recovery work and recovery participation is important to keeping dopamine receptors at a maximum. Let me just summarize what we talked about for a minute. Medication for addiction is like medication for any chronic illness. It needs to be taken every day as directed, with no vacations from the regimen. The medication works best with lifestyle changes. In the case of addiction, these lifestyle changes include a program of recovery to increase dopamine receptor level.